Okay, great, thanks. Thanks for having me. So Zahira asked me to give a quick update about CLIMAtlantic. Those of you who've met us in one way or another over the last couple of years will know about us. Others were, we launched about almost exactly a year ago, but are now a year and a half old. And we were created by an agreement between the federal government and the provincial governments to have an Atlantic Climate Services Hub available in Atlantic Canada. Quick on what I'll talk about very briefly, a bit about the team, what our role is, providing data and projections, networking and engagement, and responding to needs. And of course, all of those are all related to climate change adaptation. This is a bit of a complex structure that we have, just to let you know that we've got a board of directors, we have a governance board, we have an advisory committee, we've got a provincial working group that is only made up of 4 provincial representatives, and then a core team, or the team that supports our provincial specialists, which deals with data user needs, engagement, knowledge mobilization, communications. We've got a climate project coordinator and an intern. And so we as a core team support our now 5 provincial specialists, Willa in Labrador, Sapera in Newfoundland, Alex in Nova Scotia, Stephanie in PI, and Jenna in New Brunswick, who you probably will deal most with. And so it's, like I said, it's complicated, but it's all based on collaboration, networking, and partnering with others that are already active in the space and supporting everybody in the work that they need to do in advancing adaptation or increasing resilience to climate change impacts. So what do we do in terms of data and projections? We're directly linked, of course, to the Canadian Centre for Climate Services, which is the federal source for climate projections and data. We keep track of what comes out. So, for example, from the IPCC report, the latest one, we really keep close track of when the projections are downscaled and when they're available to everybody on CLIMAtData.ca, which is the website that you see on the right top. And, you know, we keep track of other resources that are out there, ClimateAtlas.ca. We respond to requests if somebody's looking for projections. We'll try to find it. We'll point them in the right directions, whatever is needed to understand these projections and data as well. We provide support for that. We advocate for Atlantic Canada relevant variables and information. So ClimateData.ca currently, we are currently collaborating on a marine module, which we are leading the scoping on, because of course we're very much coastal and marine. And we're collaborating with provinces on issues that are of cross interest. And I'll get a little back to that a little bit later. Networking and engagement, this is really fast. So there's a lot more that's involved in this, but just so you get a taste of where we're at. In terms of networking and engagement, we've been working on a number of pieces that we've identified through needs assessments that we undertook last year, especially in 2021, since we started. And since that time, you know, circulating information that's out there about adaptation. So we've implemented a monthly newsletter. If you have not subscribed to it, I'd recommend subscribing to it. It's once a month. And we compile information that's out there, new reports, new blogs, data that's out there. We've conducted some webinars, and again, these are usually filling gaps. When we do the webinars, the National Adaptation Strategy will organize the webinar for folks who wanted to respond to that. When the Natural Infrastructure Fund was made public, we had requests for more information, so we decided, okay, let's organize a webinar with the folks from Infrastructure Canada, specifically for Atlantic Canada. Flood mapping, it's a challenge across Atlantic Canada, different methods, different approaches, and we collaborated with Natural Resource Canada on a flood mapping conference, and also developing flood mapping best practices. We do presentations on demand, mostly those are our provincial specialists. Our newsletter, I've already mentioned it. Website and social media that we're very actively in. Increasingly, we get contacted by the media, depending on what it is, the provincial specialists or us at the core team. We are members of various collaborative initiatives across the region, just because we want to stay involved and see how we can support everybody. And of course, we engage directly with numerous municipalities, and this is primarily the role of the provincial specialist, of course. One thing that you may have seen already, this networking map was developed directly in response to a request from people. They wanted to know who's doing what in the region. Currently, there's over 100 pins for the region on the map, but we'll go out and directly engage to make sure that there's more people that are actually on the networking map. This is an easy way to figure out who's doing what in the region, and for people to connect with the right people. So if you're looking for somebody in Nova Scotia who's worked on adaptation plan or has done an adaptation plan, that should appear on our networking map if they wanted to be on there, or a consultant who's working on doing infrastructure risk assessments. Those will be also on our networking map. We've been also updating tools, or working on tools that are out of date, that were developed in the recent past, between 2010 and 2016. And the coastal adaptation tool is one of them. We've been working for the last year on updating this tool with the related documents that were developed or were put online in 2016 and were quite outdated. So we're working on this one. This should be done fully completed by the end of March, but we have an online tool that we'll test with partners and collaborators in the region in the next little while, probably in January. Just to give you an idea, in that it provides about 27 engineering coastal intervention options for adaptation and 34 land use planning options. These are all compiled in 3 documents, but you can also access them via the online tool. And the online tool, I should say, is not currently accessible. It's still in the back end. We're still working on it. Responding to needs. So one of the needs, for example, that was identified, hey, there's this atlanticadaptation.ca website that will go dead essentially, and you'll find that there's already some broken links for the old Atlantic adaptation documents that were sort of classified as a CASA. And so we're working on updating, working with ICLEI on updating their library so we can transfer very soon the documents that we know exist in Atlantic Canada that we want to make sure are accessible. And so this library is one thing that was identified through our needs assessment. We need a place where documents are accessible across Atlantic Canada that are of some sort of relevance and importance. We've also, when sort of challenges or issues are identified that are similar or that cross the boundaries of a province, we do undertake specific projects. This one happened, I think, well before Fiona. The idea that municipalities need to know what their responsibilities and liabilities are with climate change risk. In this case, it was specifically on flood risks, and the report is on our website. So this is one that we've just finalized and has come out. We're currently working on one research report on managed retreat, which should be finalized by March. And this is essentially to give an idea what's been going on, what works, what doesn't work. And this is something of interest, of course, across Atlantic Canada. And then putting some things together that, again, crossed the four provinces. The flood mapping conference in October was one of them that crossed the 4 provinces. So something that, was identified as a need because we've been working on flood mapping with Nova Scotia and some other provinces. And so it was identified as a need that we should put this on, and then we did. So that's essentially where we're at. We're fully staffed at this time. We are funded. Our current funding runs until March 2024, so we're in good shape. And our interest is really to being as accessible as possible to everybody in all 4 provinces. And as I mentioned before, Jenna Miller, who I'm pretty sure is on this call as well, is part of the Climate Change Adaptation Collaborative in New Brunswick, and will be your point of access for any questions that you have or any information that you would like. Thanks.
Mais les présentations en anglais sont aussi disponibles. Donc, s'il y a des personnes
The presentations are also available in English. So if somebody wants to have access to these slides, they're also available. So I'm going to start. So yes, my colleague took a little bit less time, so I'll be a little bit less stressed in terms of getting through this. I'm I'm going to present our project for HealthADAPT New Brunswick. And so we did an assessment of health vulnerability and adaptive capacity in terms of climate change. And so I'm Mélanie Madore. I'm a senior program advisor for public health in Brunswick. And so the goals of this presentation today is to kind of do an overview of the project and to explain to you what it was, tell you about the methodology that we used, the results that we got, the tools we developed with this project, and what the next steps will be in terms of the short, mid and long term. So the HealthADAPT program is financed by Health Canada, started in 2019, and it ended in 2022, the end of the fiscal year. And as you can see here, there are 10 beneficiaries of this program, several in Quebec, several in Ontario, 2 in British Columbia, and 1 in the Northwest Territories. In the Atlantic provinces, we're the only one that's financed by this specific project. So as I said, it's 3-year funding from Health Canada. The New Brunswick project was 1 of 10 across the country, and each project was unique in its approach. And for instance, in Quebec, they were interested in the psychosocial impacts of extreme climate events. And so they did more in-depth analysis in this sense in hospitals, and more specific to infrastructure. For us in New Brunswick, we had an opportunity to test a model on the vulnerability of Health Canada's assessment model in 2 pilot communities, so City of Moncton and the Chaleur region. So we found that the demographic data that we got were quite interesting when we compiled our data. The main objectives of our project were, first off, to improve the understanding of the link between climate change and health. We also wanted to develop information for decision makers on climate change risks and health to increase awareness and better manage risks. So we really wanted to have a reinforcement capacity, and we wanted to try to bring a better education as well. The third objective was to provide recommendations on ways in which we can reduce health impacts and inequities. And it was also a nice opportunity to work or collaborate between different key players in the climate change space, both at the local, provincial and federal level. So in terms of the City of Moncton, is obviously situated in the southeast. It's the biggest city in the province, and its geographic location is beneficial to, it's kind of the gate to the maritime. So it's become a hub. The population, according to the last census, we're at 79,500. With immigration, we should be at 80,000 plus already. It's also a multicultural and multi-ethnic city, and that obviously the presence of the University of Moncton helps with this. It increases our immigration as well. So there's international immigration, but there's also people who move from Ontario to come establish in the Maritimes, and so that has been accentuated with the presence of the university. So the characteristics of the area, it's inland. It's also along the Petit Kodiak River. So the Bay of Fundy obviously is something that we need to consider because they can overflow. The city has a big urban sprawl issue as well, especially in the northern part of the city, the Irish town. For the Chaleur region, that's located in the northeast of the province, and it's a region that is rural and coastal, and so you can see that it kind of goes along the Chaleur Bay. It's mainly francophone. The population is smaller, so about 37,000. The last census. There's the Pabino First Nation, which has about 105 members. The characteristics of the area, well, there's a big forest cover. There's large coastal areas with lots of dunes and about 30 kilometers, more than 30 kilometers of sandy beaches. What's also interesting is that there is the presence of heavy industry. And there's also a lot of natural resource projects in the sector as well. So there's Belzune and Bathurst. The reason that we chose these two regions for our pilot project was that we wanted to have an urban space, one city and one region. And we wanted to have one that was more Anglophone, with access to services. So Moncton is a perfect example of that. And we wanted to have another region with less access to services and more natural resources, and also members that were francophone. So the methodology that we used for this work, we based ourselves on the assessment model, the Health Canada's vulnerability assessment model. So as you can see here, the first three are kind of working with the community. So we try to understand, we sort of frame the assessment, and we try to figure out the capacity, and then we try to work with our partners on the ground to understand what the vulnerabilities are. The other components, 4, 5, and 6, are the same thing, but in terms of the health system. In terms of the methodology that we used qualitative and quantitative tools. I'm a sociologist, so that's kind of my bread and butter. We did a lot of surveys, polls, and so we looked at these groups. Well, these people served as our experts, and they were able to give us data or advice to guide us to the correct resources. So we established connections with people that represented these vulnerable populations. We also looked at the programs and the existing policies related to healthcare and climate change. And so we had discussions as well to present the results. And then we also did some workshops on the quantitative side. We did more of worked more with to establish relevant indicators in health to see what the effects of climate change were on health. So these were produced for the whole of New Brunswick. What were the key concepts that we used to do the vulnerability assessment? The first was exposure. Can be defined as a contact between a person and one or more biological stress factors, psychosocial or chemical or physical, including stress factors that are attributed to climate change. Sensitivity to this exposure became a determinant of health. So it's the increased sensitivity of a person that is exposed to climate change and can be related to biological, social, or geographical factors. And then there's adaptive capacity. Well, this is individuals, communities, the harm that people need to adapt to, and to look at different alternatives in terms of the reactions to climate change. And so when we built the framework for this, we looked at populations that were vulnerable in this regard, and in terms of the length of their exposure to risk. and also their sensitivity to the repercussions of this. So the results. As I've said to you before, this all comes back to ecological determinants of health, social or ecological determinants of health. So the social ones designate a specific group, social group or economic group within society based on income, education, etc. We try to also establish more structured determinants, so experiences that people can have with discrimination, racism, or other historical. So within this structural framework, we also had access to health services, which is very important. And these ecological determinants of health have more to do with our ability to live on this planet. So this depends on what we need to live in a healthy ecosystem with a good biodiversity and well, more basic elements as well: oxygen, water, food, adequate food, as you can see in the graph here, in this figure here.
When we looked at the projections, we wanted to see the one that were more likely to affect New Brunswick in the upcoming years. So, for example, there's extreme temperatures, especially the heat waves, extreme hydrological events like Fiona. There's also air quality that will be reduced. There's also water safety and quality, problems related to food security, and finally, vector-borne diseases. So maybe you think, all right, who's vulnerable in New Brunswick? If we look in the literature, nearly everyone is vulnerable to climate change. If you really sit down and take a look at it, there's a high majority of the population, 85% of the population is vulnerable once you consider all the groups. So the literature says that the most vulnerable are those that depend on others on their daily activities, children or seniors living alone and who don't necessarily have access to resources. Also, people who suffer from several chronic disease, irrespective of age. Also, the homeless and people with low income, and those that depend on natural resources. Maybe if you remind you, the Chaleur region, they really depend on natural resources, like all of New Brunswick, in fact. And the people who are most vulnerable are the people who combine those factors and are exposed to climate issues and don't have adaptation measures in place. And once we once the consultations were done, we did a vulnerability comparison for Moncton and Chaleur region. So the main climate risks that will affect the city of Moncton, it's the increase in heat episodes, firstly. Now this will lead to urban heat islands, of course, and this will also lead to water quality issues due to the presence of blue-green algae. This is an issue that we've seen over the past few years, and it has a tendency to increase. Food security problems and vector-borne diseases. The presence of ticks, for example. So in the Chaleur region, what's interesting to see is that the vulnerabilities, that the climate risks are a bit different from Moncton. There will be a temperature increase, but it will be more on an annual basis. They'll experience more extreme weather events, storm surges, perfect storms, storm surges, winds, ice storms. They'll also know sea level rise and resulting flooding and erosion. For the most vulnerable population, for City of Moncton and for Chaleur region, it's basically the same people, same categories of people who are vulnerable. Precarious socioeconomic status. In Moncton, that category includes mostly the homeless or people with no fixed address, young mothers or young children, and newcomers. In the Chaleur region, it's more the isolated elderly, outside workers, and First Nations. And for the City of Moncton, the factors that increase vulnerability, first of all, the downtown is intensively developed with little green space. There's increasing development on the outskirts of the city. As I said, there's lots of sprawl, and there are also problems of access to housing. Lately, we've been hearing a lot about the housing crisis in the media. In the Chaleur region, there's a land use and development along the coastal zone. People like to build on the ocean front. There's also limited access to health services, an aging population, a low literacy rate. In terms of social determinants of health, that's an interesting one. And there's lots of chronic health problems as well. So when we did our consultations and our focus groups, we explored the possibilities for the capacity to adapt to climate change. We came up with 5 major themes. This is the result of our consultations. Behaviors and practices, first of all. How can people adopt better behaviors to better adapt to climate change? Municipalities, NGOs can also put in place education programs to strengthen individual capacity. There's also programs and services. This is municipally and provincially where they can offer help to people. There's also program policies and regulations, as well as monitoring systems. So we did the same exercise, but especially in terms of adaptive capacity. So the first one, we did this exercise for one climate risk for that presentation, but we were interested in increase in heat episodes. So in terms of City of Moncton, the increase in heat episodes and behaviors in practice, a water park has been made available to the population all summer to freshen up. There's also capacity building, a lot of work in education and targeted awareness, especially for public health, to target emerging new diseases that accompany the heat waves. We're trying to foresee rather than heal. We're trying to work upstream. The City of Moncton distributes drinking water in permanent station, but Chaleur region will offer do water distribution as a one-off. In terms of policies and regulations, the City of Moncton right now is very nearly completing its sustainable development plan, and that will include urban forestry. In terms of monitoring systems, the City of Moncton and the Chaleur region have a heat wave warning and response system, and the City of Moncton, they do an excellent monitoring of recreational and leisure waters, so that to see if there are issues related to blue-green algae. As for Chaleur region, they do monitoring of winter thaw infrastructure, the freeze thaw cycle. So, to close out, from a vulnerability perspective between the two regions studied, what we saw was that the climate projections between regions and cities in New Brunswick are relatively similar. There's not a major difference in terms of the climate projections, but what's different is the impact of the climate risks. For the City of Moncton, as I said, rising temperatures mean an urban heat island, seasonal water and air quality issues, and the emergence of new diseases such as Legionella, which we've seen in the media. And this is connected to the use of AC. For the Chaleur region, the main impact of rising temperatures will be, it's nearly only damage to infrastructure, given the freeze-thaw cycle that will come into play more often. Also, as another conclusion, from an adaptive capacity perspective, we found that the ability to deal with climate hazards differs greatly between the Chaleur region and the City of Moncton. The ability to implement effective adaptation measures that are effective and that properly reflect the needs, it depends on the local resources currently in place and the understanding of climate change risks. And however, as we've been able to see, smaller municipalities often rely on external experts. So these are consultants or researchers / academics. They do studies and then they leave with the knowledge, but the municipalities don't necessarily know how to implement that knowledge, how to make it possible, how to do a natural follow-up. They don't always provide all services. For example, drinking water and emergency measures. And the larger cities, in our opinion, have a lot more resources, financial or otherwise, and capacity at their disposal to deal with the challenges that climate change will bring in the future and currently. So the last part of this presentation will be I'll be sharing the tools that we're developing this project. First of all, it's the Climate Change in Your Health website. It's online since October. You can review it. You can see all the toolbox that we've developed with health adaptation. So please, you can get some resources from there. The sensitivity profiles for us is also accessible online. There's a provincial profile, but also for the 33 NBHC communities. For those of you who know the New Brunswick Health Council. And finally, we've also developed a bit of an infographic. It's an educational tool, awareness raising tool. We took up the major climate risks and we proposed healthy measures that people can take up to adapt to climate change or how to better foresee the effects of climate change. And finally, the next steps were in the knowledge dissemination phase. We're trying as widely as possible, and thank you so much for the invitation. This is what we want to do right now. We want to launch this project and disseminate the information. We find that the information is relevant, and if other people are interested by it, please let us know. It would be our great pleasure to present it. We're also doing funding applications. There's a New Brunswick vulnerability that we've applied for it for the Tranchamar region. There's also 2 other projects in 2023 that we'd like to do. We want to do an NB vulnerability atlas like we see in Quebec, but we want to transpose it to New Brunswick. And we also want to have some capacity building of health system actors. We saw, as we did presentations, that many people within the health sector are interested by climate change, but they don't find they have the right tools. They don't know how to go about it to be proactive. So I think that this is a project that will fulfill that need. And long term, we want to work with the health infrastructures to better understand where they're vulnerable and to work on the resilience of the healthcare system. Well, thank you very much, and I hope I didn't speak too long.
They have a few questions lined up and ask them to maybe voice them one at a time.
In fact, I do.
And then just to direct the question to directly to the speaker that they're asking information from.
So I think this is for both. Oh no, this first one's for Sabine. Who is the target audience for the coastal adaptation tool?
So they're both communities, so smaller communities primarily, the either counselors or staff in smaller communities that don't have capacity, as well as we've got one part of the tool that's for property owners, so individuals that live along the coastline.
Nice. Could the coastal adaptation tool be applied or used in other coastal communities, such as up to north in our territories?
So Jenna answered that in the chat already, and we haven't looked at permafrost or any of the northern challenges in this. So it's really for the southern air for this area, the Maritimes, and including parts of Newfoundland at least. So I would say not at this time, but there are principles in there and ideas in there that would certainly also apply in terms of adaptation options that may apply.
Okay, thank you. Is there any possibility of reviewing the key concepts of vulnerability in English during the question period? So we did share the slides in English, but I wonder if we could just bring them up and look at them verbally, perhaps?
Okay.
Look at them verbally. How do we do that? Look at them and then also verbalize them. And while that technical stuff is happening, I see Corinne has her hand raised. Do you want to unmute?
Yeah, thanks. I have a question for Mélanie. You talked about the disconnect between researchers' results and implementing those at the municipal level. I'm wondering if you have any recommendations about how to do that better.
That's a good question, because I know that there's a lot of papers and all that stuff coming out of those studies, but I don't know how the municipalities, with like the resources that they have, maybe with the local governance reform, maybe that will change, because there will be more people on the ground trying to do those recommendations. I'm not sure. It's a good question.
Oh, thank you.
Yes, feel free, if anybody has a question they'd rather verbalize, to just use the reaction button on the bottom of your screen and then raise hand to facilitate that. We have plenty of time. Our break is not until 11:20, so we've got about 20 minutes to fill.
So speaking of which, Sabine, you had mentioned at multiple times that you were going very quickly. If there's anything that you'd like to bring up that you might have missed in the sake of brevity, thank you so much for being so timely. I can give you that to think about. And it looks like Adrian Prado also has a question.
Adrian, feel free to unmute yourself.
Yeah, so it's a question for Mélanie. Mélanie, je voulais savoir si tu avais trouvé des...
I want to know if you found any relationships in your study and what we were able to observe during COVID, the social vulnerabilities or other connections that you're able to make. With this study, well, in working with NBIRDT that already had a project on vulnerabilities re-COVID, well, there was a lot of information that kind of came together. And so we work with NBIRDT as well to make a connection with climate changes and COVID, to get a better impression, because we know that public health during COVID, well, COVID took up a lot of our, kind of took precedent. So we want to try to make connections between the two of them. So that's part of our project in the future. Thank you.
Anyone else?
Pick a note.
There's actually one thing that I just wanted to mention, which is we're also doing a research report, and Tracy Wade is involved in this, on sea level rise and health impacts. I don't know if Tracy's on the call, but part of it is already publicly available. That's with a BC Health Center. So we'll have that linked from our website as well. But for those of you who are interested in links between health and climate change, this is also one that should be really interesting.
Nice. Is the provincial government conducting financial analysis on future impacts of climate change and the health system?
Whoever wants to answer that one.
Not yet. We're still trying to get some funding because after HealthADAPT stopped in 2022, they were waiting for more funding after the national adaptation strategy. So we should know better by the end of 2023, like how much money to apply for and what will be the next step.
Jeff, you have your hand up. Go ahead.
Yeah, Sabine, you mentioned downscaling predictions to community levels. And one of the challenges, I think, historically has been that there's a sense that until the information is perfect, there's no need to actually act. And as we both know, there's no such thing as perfect information. So in that process of downscaling the information to community levels, are you sensing any acceptance that we're going to have to start to do things, even though the information will never be perfect, or flipped on its head, when we actually have perfect information, it will be too late?
It's quite a loaded question, Jeff. So first of all, we are.
Would you expect less from me?
No. So we're not the ones who are downscaling. Okay, so that's just my number one. My number two is I've always had a challenge with wanting more and more detailed information, and that actually pans out when you talk to modelers, that there's only one type of information and data that goes in those, the global models and then into Canadian models. So that's the same data that goes in, and unless you add new variables, the smaller you get, the more detailed the more you want to get to the community level, the more inaccurate or uncertain it actually becomes, because you're still using the same coarse scale global, going down into a smaller kind of, you're funneling it down. So that's just a simple answer to, we've got enough to do what we need to do. Okay. But I'm also very cautious in when we look at what we get as the set of information or projections that are considered to be the gold standard, that changes all the time. So I'll give you the example of Hurricane Fiona. Hurricane Fiona and the water levels that were observed during Hurricane Fiona were, according to projections, not even a 1 in 100 year event. It was beyond that, so more than that. Which means that as people who look at climate change impacts and at adaptation, we need to always look at the extreme and expect the extreme and then go beyond that if we really want to make sure. But that means we do have enough. We do have enough. There's always more that we can get, more research that we can do. But for climate data, for the projections as to what is happening, CLIMAtlantic will keep track of how significant those projections are that are coming down from global and then Canada. But like I said, I mean, what we have is perfectly sufficient right now, as long as we don't stop there. So when you have, for example, the flood risk maps that are out there, you can't just say, okay, we now know what's going to happen, we're fine with that. Well, that's not the case. It's not the case that you can just plan with those kind of current maps or current information in mind. You have to think forward, that the trajectory that we're on currently is one where we are already hitting the worst case scenario. So when somebody tells you, well, I'm going to plan for middle of the way kind of scenario because we're all doing something about greenhouse gas emission reductions, well, that's not sufficient anymore. It's definitely not where we are going in terms of sort of the global direction of our greenhouse gas emissions. So this is a complicated answer to a complicated question, but it is what it is. Like, I'm never going to tell anybody that here's the projections, work with those. I will always say, here are some projections that'll give you a start, but plan for worse. So don't limit yourself in what you're getting. But also, the newer data that we have available, or we will have available soon, we will push that out and make sure that people have it and use the newer data, the newest information that we can, to actually make decisions, because that's what it's really about. You make the decisions on the best available information that you have.
Can I ask a quick supplemental? So does CLIMAtlantic, have you played any role in advocating for actual data to be collected? And I say that because, as an example, for Hurricane Fiona, there is not a single buoy in the entire Gulf of St. Lawrence.
Yes.
that collects
yes.
data on waves and so on. So you can't even test whether the predictions are right because there's actually no data being collected.
Yes, so this is part of our role as well. It's both in making sure that we provide or we link the information to the people on the ground, but we also link the needs back up. So we have been involved in providing feedback to the National Science Plan, which does provide an opportunity to include, well, we need more buoys, we need more tide gauges, we need more ABC, right? So that's part of our role as well, and we have been doing that. So we're keeping track of, well, what's being planned. So I know that the tide gauge challenge has already made itself up, and maybe Rob has some information on that, but it has already made its way up, and hey, we need this. So and we support the provinces when they identify those kind of needs for monitoring and data collection.
Yeah, the one in Shediac failed at about 2 a.m. when Fiona came through. There's no data after that. Not helpful. Thanks.
Thank you, Jeff, for that very deep question. It's certainly not a good answer. I think Zomi put the order of our hands raised in there. I'm just going to try to find. Okay, so Renee, vous êtes première.
Prativa was first.
Oh, okay. So Prativa, go ahead, Prativa.
Hi, Sabine and Mélanie. Thank you for the presentation. What I was trying to ask to Sabine was like, it's great to see CLIMAtlantic put different tools and resources are already in place in this short duration of time. I'm just looking into your reaching out, your outreach and engagement with different stakeholders in the province. How has that been going on in terms of delivering those information to different stakeholders first, and secondly is we would like to see you again in these type of conference so that we all get an update of your work.
Yeah, so one piece is, as I mentioned, we've got the provincial specialists across the 5 regions. Labrador was identified as a specific need, so that's why we have a 5th one. So Jenna Miller is really the person who will and is doing the outreach, but I can give you an example just how this will work. So that I showed very briefly that risk and liabilities report, a research report that we commissioned. And our plan, for example, is each of the provincial specialists will reach out to their municipal associations, will make sure that the municipalities have information about a webinar that we'll be putting on in January, I'm hoping, just specifically for that report. So this is the CLIMAtlantic organized, but the provincial specialists will be doing that outreach, right? So, and then each provincial specialist, and in New Brunswick, obviously it's Jenna, will identify those specific needs in terms of working, who is on the ground, who will they work with, and that is again a sort of a two-way thing. So we get contacted at CLIMAtlantic, somebody from New Brunswick will pass it on to Jenna, and if Jenna gets a request that deals with, for example, data projections, she'll contact our team member who's responsible for science and data, and that will then go back to Jenna, and Jenna will be connecting with those people. So anyway, but how it's been going, Jenna is the better one to answer that one.
So I've just spotlit Jenna there. So Jenna, if you want to just add a little piece to what Sabine just finished off with there, feel free.
Thank you so much. And yeah, really like Sabina was saying, I'm the New Brunswick provincial specialist. So any questions and any information that anyone would like, I'm a contact for you for that.
Thanks, Jenna. Okay, before we keep going, I think, can we just ask all of our participants to just make sure you've got your full name in your ID so that we can identify you as you're asking questions. I think it's useful for the other participants. They can connect with you if you say something that they feel it might be useful to them as well. And then I'm going to move on to Renee, your question.
Oui, merci pour ces.
Thank you for these great presentations. My question is to Mélanie. I know that you studied only Moncton in the southeast, but the islands around like Dieppe and others they're very interested in the results of your project. So how do you think they will work in concert in the fight against climate change? Because if a city makes certain adaptations, well, it can influence other cities positively or negatively. So what are your ideas on that? Absolutely, that's a good question. We asked that question a lot, actually, while we were working on the project. It's kind of the same dynamic in terms of establishing the different regions. Same thing up north with, we decided to take Moncton and to try to make them representative of the cities. So the idea was that all the communities would do their vulnerability assessment so that they could be included in the plan for climate change adaptation. So it is a long-term vision, but to answer your question, no, the city of Dieppe, and I totally agree. Everything is interconnected. And when we work on initiatives or we implement adaptation measures, we shouldn't just benefit from these in the regions where they're implemented, but other surrounding regions as well. But that's my answer. Thank you, Mélanie, and thank you, René, for the question. Rob.
Rob? Oh, yeah.
Much, Zahir.
You've muted yourself somehow again. There we go.
Yeah, okay, there we go. Well, thank you very much. Bonjour à tous.
Hello, everyone.
With the Climate Change Secretariat. I'm the Director of Adaptation Services here at the Secretariat. Thank you very much, Sabine. Merci bien, Mélanie, de vos présentations. C'était super. Peut-être pour répondre.
Thank you for your presentations. To answer René directly. René, normally the municipalities have an adaptation or an action plan for climate change. And in Greater Moncton, Dieppe and Moncton have old adaptation plans. So it is in our objectives to engage with those two cities and to get an adaptation plan that is up to date, that could inform other initiatives related to health for those two cities. So that's something that's going to be coming up in the future, and we're going to wait until the new amalgamation is complete. So we're going to present this in front to all cities that don't have an adaptation plan, so to make sure that they have one. So that's something that's going to improve the situation, I'm sure, for the other two cities.
I just wanted to chime in on the adaptation and a little bit to answer Jeff's inquiry. I think, Sabina, as you mentioned, we have great tools that are based on projections, like the flood hazard mapping, and our experience has been with 56 municipalities in New Brunswick of the 104 existing municipalities, where we've developed climate change adaptation plans with the municipalities, and overwhelmingly, whatever we present as projections are taken as gospel, if you will, Jeff, and folks that are working on the adaptation plans for those municipalities, for the majority, have extreme confidence in those projections. They know their projections, but they almost always tend to pick the worst case scenarios. And I think a prime reason for that, especially with flooding, is that they've seen those projections already on the ground with the amount of flooding and the depth of flooding that occurs, especially on the coast. So we've had in the last 3 years, as you're well aware, 3 large events. And when you go to a coastal community and say, hey, we have projections, based on flooding, and we're just here to tell you you're going to flood, well, you can really almost get laughed out of the community, because they're well aware of the threat. They've seen those historical events surpass even the 1 in 100s with climate change in a lot of cases. And I think behaviorally, they're really adapting and incorporating those risks at the extreme levels, the 1 in 100 with climate change projections into their planning. They're incorporating that knowledge and those projections into their decision making. So I think, it's obviously, the most precise data that we can get, but there hasn't been any resistance really with the municipalities and the practitioners with adopting those extremes projections and taking them as as very good information. And I think what allows them to really incorporate climate change decision making is that they've seen the impacts. So I would say it's great to work towards the ultimate precision, but practically speaking and behaviorally, those projections are making people change their behaviors and focus on adaptation. Just kind of the practical aspect that we've had the privilege of being a part of, working with all these municipalities. Thank you.
Thanks, Rob, for that in-depth look into the adaptation plans. I think it's definitely valuable. Jeff, did that answer some of your
thoughts? Oh, yeah, no, I mean, obviously that's reassuring, because that's a step forward from, say, 20 years ago. So that is good. I'll wait till the next session. I'm still concerned, though, about the data question, because like for the entire North Shore of Prince Edward Island, I'm not aware of anybody who has a water level record. So when somebody says, well, the storm surge was this, I don't know how we know what the storm surge was, because the federal government doesn't operate any water level stations on the entire north coast of PEI. And the UPEI Associated Center has a number over there, but most of them fail. The majority of them failed during the storm. So we actually don't have storm surge data, water level data for that storm. So I think that's good, but I think for communities, the ability to at least have data, they see it, they can see the water on the wharf, or they can see the damage that's being done, but it still would be helpful to quantify it. But as I say, I could make those comments during the next session in terms of response to Hurricane Fiona, because I've taken a number of media calls saying, well, what was this? What was that? And I can't answer the question, because I go on the Environment Canada website to find data and there's nothing there. Yeah, or in the case of Shediac, the data just ends at 2 a.m. in the morning.